Welcome to the CloudCare Podcast, where we ignite impact in behavioral health and human services, one conversation at a time. Join Bob Bates, CEO of Continuum Cloud, as he explores the evolving landscape of behavioral health, uncovering the latest trends, challenges, and innovations shaping the future of care. From expert insights to real-world success stories, every episode is designed to inspire action and drive meaningful change. Powered by Continuum Cloud, the only platform built for behavioral health, we're here to help you address the workforce crisis, improve clinical outcomes, and achieve financial sustainability. Ready to make an impact? Let's dive in.
Hello, welcome to CloudCare Podcast, episode number 4. Our topic today is navigating one big beautiful bill, and who better to help us understand what the ramifications are of that and how to survive that than Monica Oss, the CEO of OPENMINDS. If those of you who don't know Monica Oss, which I think we all do, but for those that don't, subscribe to her newsletter. It's pretty amazing. You get 2 to 3 facts every day and documents, and anything that changes in the industry, even suppliers, providers, etc., and even tips and tricks for how to navigate this is coming from her, and we really appreciate what she does for the industry. So, Monica, thank you for joining us. I did want to take a second and say, for those that don't know me, I'm the CEO of Continuum Cloud. This is not only our 4th podcast, but we also have a series of webinars, etc., going on. And Continuum Cloud is a behavioral health platform with an EHR, which is Welligent. Our human capital management, when you hear that, just think HR systems, which is Datus, and also our Cared For platform, which is a patient engagement platform for substance use disorder, and also just our digital gateway into that platform. So for those that don't know us, that's what we do. And Monica, thank you for joining us. It is an honor to have you here, and I can't wait to roll up our sleeves. I know you've been doing a lot of homework on what does the bill look like now, and now that it's approved, and what is it going to do to us. So I wanted to start there, if that's okay. What key legislative changes are happening now or in the next 3 to 4 months? That's now. What can people plan for? And then what's coming in the next 2 years? And then we'll talk about what do we do with it? What would you advise us to do?
Sure. Well, first of all, Bob, thank you for having me. I am thrilled to be here today on the 4th of the Continuum Cloud podcasts. So, let's just start with, I think the past 7 months have been ones that we've seen remarkable change in federal policy and federal legislation. You mentioned the One Big Beautiful Bill, which is certainly one big piece of that. And while the bill has many, I would say many provisions affecting healthcare, I think for our listeners today, there are really 3 that I think everyone needs to focus on. First of all, coming up the end of this year will be the bill allows the premium supports for people on the exchange to expire. That means that many of the people getting their health insurance through the ACA exchanges will likely drop off and become uninsured. So that's an effect we're looking at in the near term. The Medicaid work requirements for the expansion population are set to start in November of 2026. And in the meantime, I think the overarching piece of the bill is there are cuts to many programs in healthcare and outside of healthcare, and a lot of momentum to push many functions of government to state and local government entities. So I think those are 3 big things. And if you don't mind, Bob, I just wanted to point out there are some executive orders that have happened in the same time period that have equally big implications for the field. The CMS has issued a guidance that they will no longer be paying for health-related social needs. They said the existing waivers can stay, but there will be no new waivers to fund things like housing supports and transportation, food as medicine programs. The July executive order on homelessness, addiction, and mental health signals a very big change in federal policy, moving from things like housing first and wraparound services to involuntary commitments for people with mental health and addictions who are homeless. We also see the sunset of SAMHSA and HRSA, which will now become part of Make America Healthy Again, and some significant reductions in both grants from HHS and grants from NIH and NIMH. So, yeah, that's compressing a lot and thousands of pages of documents into kind of a big overview. But I think, Bob, that gives our listeners a sense of some of the key points that are going to be part of the new healthcare fabric going forward.
Awesome. A couple questions as we look at that. The SAMHSA changes, I think people underestimate that, and also ACA as well. What would you say when I look at ACA and the cuts there, there's a double trigger almost there as well. For those that didn't opt in, it's probably better because it's not going to have to wrestle with what do I do with the uninsured coming forward. What do you think the ramifications are going to be for that, for red versus blue states, or for states in general? It seems like that's a squeeze for the same dollars.
Short term, I think that when you look at the exchange cutbacks in terms of premium support, those will likely affect red states more than blue states, because the blue states have by and large expanded Medicaid, the red states have not. The red states have more of the population buying their insurance off from the exchange. But roll forward a year, so that's the end of this year. Those are effective in December. Roll forward a year, and then you're going to see the work requirements put in place, and all the re-eligibility determination requirements for the Medicaid expansion population. And that will conversely affect blue states more than red, because more blue states have expanded Medicaid. So short term, I think the red states will see the bigger impact. Longer term, in end of next year, the blue states as well.
You see ACA going away in general. And then the next question I have is actually to go to CCBHCs and say, okay, when I hear grants and waivers, it's really in the grants area. Do you see CCBHCs existing as they are now, and what changes will there be?
Well, a couple things on the Affordable Care Act in general. Certainly, the end of the Affordable Care Act is a stated goal of Project 2025. The challenge, I think, for the current administration is that it's actually quite popular, and lots of Americans get their insurance through provisions of the Affordable Care Act. So we'll see sort of how much of the Affordable Care Act is dismantled over the next couple years. I'm sure some, and obviously the premium supports piece is a start, along with kind of making it more difficult for the Medicaid expansion population to stay insured. On the CCBHC side, I just don't know. On one hand, I would say that long term, I think the funding for all of the SAMHSA initiatives will probably start to be squeezed at the federal level as we see, kind of competing priorities at HHS. It appears that they are not going to claw back for the next year the CCBHC grant funding that's out there. So we probably have a year of stability, and then it remains to be determined. I think a bigger factor, Bob, to think about is, what are the states going to do with this? As states look at their costs for any federal initiative, crisis services, 988, CCBHCs, as states feel their funding squeezed, are they going to pull out of some of these programs to trim their own budgets?
Yeah, good question. And that's, we were talking the other day, I see that being an issue state by state as well, is how do they manage the squeeze? Some see a high priority on behavioral health. And then, the question is it IDD versus behavioral health? Do those get squeezed? But the spectrum we have is pretty wide in behavioral health. I think most people don't understand the complexity there unless you run a clinic or you're really close to it.
Yep. The economy's softening a bit because of the tariffs, and the state in revenue is likely to decline while there's more demand. So healthcare in general will be competing with education and corrections and road building. I mean, there are a lot. I don't envy governors right now. I think there are a lot of tough decisions coming.
When I look at the constituents we serve, it's it's pretty complex. But I look at when you start to say that you're not going to provide services for home and food, and you're also typically the behavioral health, for one who has a 24-year-old, I know what would happen if I was not there to provide care. And if group homes start to diminish and we have less of those as well, they generally end up out in the street. So what do you see long term there? And I don't want to go with, speculation of political, but it would seem to me like, the thing that we're trying to solve, the homelessness issue, is actually going to get exacerbated. And then you're going to see, and at one time it was institutionalization, which the government got out of that business as well. So what do you see the end game there? To me, that's, I'm blessed you don't have that problem, but others will.
Yeah, I do see the likelihood as, there's a pretty high correlation between people who are uninsured, people who are unemployed, people who are homeless. I mean, those rates of those things tend to go up in parallel. So it is likely we will see, more homelessness as a result of some of these policies. I think the question about, kind of what happened, and my concern, I'll get back to you. You mentioned group homes briefly. The different types of providers that are serving these populations, I mean, they're having financial sustainability problems. The past 2 weeks, I've gotten notices from several organizations providing group homes that they are closing their group home programs due to finances. So we're going to see, I think, some shifts in the market map just based on individual organizations and their ability to keep the programs open. I think the big unknown for me is the executive order that came out mid-July, the one that talked about homelessness and involuntary incarceration. I mean, the executive order did mention that there would be grant money available to state and local government for treatment for those folks. That will be the big, I think, question about the model. Is the model more like, mandated treatment, or is the model more like mandated incarceration? And I would say at this point, we just don't know.
Wow. I learn every time we have these interactions, and it really is people look at change as something negative to an industry, and I actually think there can be positives that come out of this. So we even look at that even before I was in healthcare, but I wasn't over in behavioral health. It was like, that's the opportunity to do something different and provide a different level of care in a more efficient way. So that would lead me into my next round of questions for you. And I'm sorry I'm putting you on the spot the whole time, but like for financial sustainability, I know that, you are near and dear to that because you also do consulting on the side as well. And a lot of what you've published is insights into how people survive. You've got good stories or good use cases there. What do you recommend for financial sustainability in the new landscape or the new set of rules that we're operating within? And it's going to change. It changes every 2 years anyway. So you've probably been doing this anyway. This is probably the greatest change, but just curious your thoughts.
Yeah, I mean, some of it is, in the end, if you want to, I'll start, maybe you and I can start at the big picture and kind of work our way down. Yeah. For most organizations, the challenge is going to be managing their margin. And that's going to be managing the margin for fee-for-service payments, trying to preserve margins on grant-based programs that they get, and trying to, make some headway in terms of getting value-based or gain-sharing contracts with health plans. That's kind of the scope. What's going to complicate this is every organization is going to be affected a little bit differently by some of the industry factors. What's the cost of their workforce, including benefits? I mean, we're now seeing they're projecting that health insurance or medical health insurance costs are going to go up 9.5% next year. That's a pretty big bump for an organization that has a 2 to 3% margin, and 80% of their expense is human capital. There are certainly the costs of technology needed to kind of navigate this change. There's the increased marketing and development costs, and something everyone underestimates, the cost of executive talent. So, the executive teams need to navigate this and deal with more paperwork, I would say, more dominance of the health plans and increasing number of uninsured or underinsured folks. That's kind of the financial sustainability roadmap.
Yeah.
There is a framework for dealing with this, but the financial sustainability challenges, I think, are something every executive team needs to understand from their own organization's perspective in order to manage through this.
Yeah, one thing I just learned, and I usually know that, so it's kind of it was a shock to me to understand what the normal margin of an agency or a set of clinics is. What can you share with the audience, what is a normal margin level? Because if you take that and you're saying 10% Medicaid cuts, a lot of grants are going away, and you've also got the cost of healthcare is going up as well. That could be a squeeze of almost 30%. What's the normal margin of one of these facilities?
Community mental health centers, child welfare agencies, federally qualified health centers, their margins are in the 2 to 4% range on average, or I would say probably kind of the median. There will certainly be organizations above or below. Hospital margins were running around 7%. They have on average declined to about 4%. And it was interesting. There was a new study that came out just this week of Pennsylvania hospitals. They were saying the margins were in that range, but 37% of the hospitals in Pennsylvania are losing money. So I think all of these averages, we have to sort of assume they're kind of in the midpoint, but there's going to be a fair number of organizations that are, even now, before most of these effects take change, kind of looking at negative operating margins. And those are things that board members and executive team members, my advice is address them sooner rather than later.
Yeah, that's a good point. Is what are the good, what tools do you need or what data do you need? And to me, it would start with margins. Like if you're not, you can call it profitability. We call it sustainability to make it a soft term. But the truth is, if you don't have a margin, you don't have a room for error. And you also, we're mission driven. So people want to get back to like the indigent part of society or provide additional services people can't. So, basically can't afford it. If you're wanting to do that and your margin's 2 and 4% and you're seeing a 10 to 20% cut, what are some of the things you're looking for to say? And to your point, do I continue as is? I'm assuming the answer is no, and there's going to be a revolutionary change in this industry that has to occur.
Yeah, well, a few things. Let's maybe start with thinking about the framework. I mean, for most organizations, when I'm working with the executive team, I'm looking for 3 things. Do they have a scenario-based plan? Do they have metrics-based portfolio management? I mean, that they're actually doing in using the data. And do they have a fairly aggressive growth strategy? To me, that's the 1, 2, 3s of how do you manage through any time of market turbulence or uncertainty. And, and just a little bit for each on the scenario-based planning, I always say you've got to think about what's the preferred, the possible, and the likely. And the preferred meaning here are things we are going to lobby for. The possible being here are things that could happen even though they may be catastrophic. And the likely, most likely scenario is what you need to kind of base your operating plan on, always being ready to pivot. Does that make sense?
It does, totally. That's actually, so people are getting a free consulting visit from Monica and team, which do consulting, help these agencies out.
Yeah. No, and with that, the big part of that, and you and I have talked about this before, a big part of that scenario-based planning is doing your data analysis of your service lines. Which service lines are making money, which are losing, which are growing, which are shrinking, which are core to your mission, which are secondary to your mission. Because as we look ahead, every executive team is going to need to balance the books in terms of the things they're doing that are mission-based that they may need to underwrite and the things they're doing to actually, kind of pay for their mission.
Super, super helpful. The other question I have for us, like when you're talking about the data, in your experience in working in this industry, do most people pay attention to those metrics and understand what, and you can inundate yourself with data. I struggle with the same thing. Like there's a lot of data that, at the end of the day, you can use to to run a company, but the truth is there's 3 to 5 major critical areas you look at or artifacts that basically drive your business, and the rest are supporting. They're not really the what I call a key performance indicator. Which ones do you think those are? Is that just, the funding level and utilization? What do you think?
Yeah, I do advise executive teams to try to slim down the amount of data that they look at on a routine basis, which I hope is weekly. But that is like, it's revenue and margin, by overall and by service line, by payer type, look at payer mix, and in terms of top line and bottom line. Then you've got workforce metrics, turnover rate, time to fill open positions, because those are critical essentially especially for revenue generating positions. And then there are, I would call them performance metrics that are related to customers. What's your net promoter score at the consumer level for particular programs? What are the, outcomes that you're trying to achieve for the consumer or for the payer? And then critical, if you're entering into any kind of performance-based or value-based contract, a set of metrics, I would call them on the side or parallel, that show how you're doing in each of those contracts. Are you going to, essentially achieve your bonuses in the program or not? To me, Bob, and maybe you have some to add, those are the core metrics that I think are fundamental to trying to manage through times of market change.
No, that's actually super helpful. And we do, not only does our company do that, and I think anybody in this space that's going to be around and grow, I think there's an opportunity for growth. And growth means providing additional services, et cetera. But you're absolutely right. There's usually a set of key KPIs that we look at. Key is first word in that. And one of those is revenue. The next one would be margin. And then, what do you reinvest? It is no different from a supplier to a provider. So I don't differ at all. And then SLAs, you're absolutely right. What are you on the hook to provide? And are you doing that? And it's ironic. It's almost identical. Like we look at what you call an NPS, but it's a survey basically saying, do you want to do business with us again? Would you recommend us? So those are the things you talk to your customers about and say, are my services valuable? And are we doing a good job servicing you? That part, we're in a human business, human factors business, and yet people don't pay attention to that. One thing I did notice, and you mentioned it, that's why it's important to have the HR system tied to your EHR. I think it's mission critical. You have to, because you look at the ability to track productivity. You look at the ability to the financial viability of those funding sources, and then what is the turnover rate, and when can I actually have somebody in that position to fill the staffing to basically generate additional revenue? You were talking about earlier the possible or the preferred. That's in those realms. Like if you want to grow services that are profitable, you should be able to either move people there or go recruit people to go there, and that's not a 5-day process. There's criteria for that. There's certifications, et cetera, and also you're competing with the public sector versus the private sector for those same employees to fill those positions. So that's like the full gamut of what we do. It's almost identical.
Yeah, it is. And I am not, as much as I am concerned about the policy changes that are happening. There are lots of opportunities, because sometimes execs will ask, how can you have an aggressive growth strategy in this market? And there are some big opportunities that, part of it is, can you create high value, low cost programs for cash paying consumers? Because there's going to be more of them. Capitated direct care programs, group therapy, virtual service systems. Many models for doing that. Health plans are going to be under more and more pressure over the next 24 months to reduce their medical loss ratio. So there's opportunities for serving those high needs, high cost consumers and coming up with behaviorally led primary care, admission, readmission prevention programs, community-based follow-up. There are lots of opportunities in that bucket. And then the other group that is likely going to be very negatively affected by these changes are the hospital systems, and thinking about the opportunities for hospital system partnerships to address the very same consumer groups. And last but not least, I always like to point out that anytime you have a turbulent market, there are going to be market failures. And you want your organization to be prepared for when the right service comes up. If an organization, abandons that market, to be prepared because it's something that you do well and has a margin to open up in that geography or serve that new consumer group. So those are just four, Bob, of the, I think, big opportunities out there for entrepreneurial executive teams.
That's awesome. That's actually was going to be my next line of questions. So perfect. How do you adapt, and how do you navigate the shift? And those are some strategies. My question is that, when I hear you give that strategy, how do you execute that strategy? Do you have a network of people and you're looking for those? Back to what we were talking about earlier, you got to have the metrics and say, I'm actually profitable here and very good here. But
it starts with having the metrics, and for whatever your strategy is, measuring on a real-time basis how that's going. I mean, are you losing more money than you thought? Are you exceeding or underperforming in terms of market share? Those are things that when you're launching something new, you want to know right away. But I would argue, and here's a note, that before you start on any of those growth strategies, you need a good business plan for whatever it is. And you need a steely-eyed assessment of whether or not you can actually afford to do it. Or if you do not have the capital, the talent, or the time, do you need to go find a partner? And that could be a merger, it could be a joint venture, it could be, whatever it is. But I do think that as organizations look at needing to grow, one of the questions for every board, for every executive team is, do we have what it takes? Or do we need to find a partner in order to get the resources we need to actually grow?
That is absolutely the next question I was going to ask. The note. And you gave us three. It's capital, it's time, and it's talent.
Yep.
And I will say private versus public, it doesn't matter. It's the same thing. What I found is if you're not growing, you are slowing. You rarely ever get to stay in equilibrium, and not in this market. I don't believe that when you see one changing like this, there's got to be a change. And the only way to make that change is understand what you're good at and what you're not, and then be bold enough to say, I'm better with somebody else.
Yep. What you want, I keep telling every organization, whether they are nonprofit mission-based or a for-profit, sector-specific organization, what you want is to keep serving the consumers you serve. How you do that will change with the market.
I have one really personal one, and it's not personal to you, but you've been consulting for a while. What's the biggest surprise you've had when you've been out helping some of these agencies and clinics?
I think there are two that continue to surprise me. At the very elemental end, I am continually surprised at the number of organizations that really don't have those basic metrics to manage. They say they do, but they really don't, or they get them 3 months late. They're not really useful for decision making. So there's that piece. And then I would say the other surprise, Bob, is, you work with an organization, you put together a strategy, a marketing plan, a technology plan, whatever it is. Mm-hmm. And the inability to actually execute on the plan, to make the decisions and make something new happen, has been the other, I would say, surprise. And these are not surprises of the past. These are surprises of the present. Surprise that I see in the field every day.
That's awesome. Thank you. And I'll go back to, again, it's kind of ironic. The paths are parallel. It doesn't differ whether you're on a payer, provider, supplier. It is the same thing. I've consulted as well. And it's, you can put together a great plan, but if you don't execute it, at that point, it's a hobby, and it's actually a waste of.
The Confucian saying, an unread book is a stack of paper. It's the same, the unimplemented plan, really is a paperweight on your desk.
I agree. That's a good analogy. I'm going to have to steal that going forward. There's a Southern saying. So growing up in Florida, it was like, buy your books and I'll send you to school. But if you eat the books, it doesn't do me any good. So that was my neighbor. And I guess he was probably using the analogy for me because he saw me skipping school a couple times. So I guess that's the top three for me. And the third area I thought we cover is technology. So I'd love to hear your thoughts on, if you're picking, if you're looking at technology and what it can do for this industry, how important do you see it? And, what would you ask if you were asking somebody that's a supplier?
Well, a couple of things. I don't think that service provider organizations can navigate what's coming without investing in some kind of digital transformation. And that means investing in technology for more functions than just EHR and billing.
Yeah.
So as we look ahead, I mean, the four things on my hit list, and I'm forgetting about compliance and regulations, is do you have the data for decision making? Can you accept value-based contracts? Do you have the data to manage your workforce? And do you have the data for a superior consumer experience? And to me, those, again, moving beyond compliance and talking about strategy, those are, to me, the four kind of technology functions that executive teams need to be thinking about. It's
funny. I would normally be the one answering those, and those are actually perfect. I totally agree with you. Decision making, and when you look at that, decision support systems, what we call them, and rules based. Anything we can do to optimize have the data, to streamline the data to things that really matter, measurements that matter, MTMs, which everybody calls us. But most people use it as an acronym. You really have got to understand what's important to your business and the data supporting that. And then anything in a system that can, you were talking about the HR piece, you have to tie the HR piece and the digital front door as well, is what we call it, our digital gateway. You have to enable those services for people on the go. There's going to be residential services coming. Telemedicine is coming. I actually think that with, the stigma of people not wanting to know when they're in the process of receiving care, you got to make that easy. And those are some of the tools that will do that. And then we have a workforce that's overworked, trying to serve the same. It's natural. We want to serve the same number of people we did before and help the population. And we're going to have, the tools cannot be stagnant. We're going to have to bring innovation into this industry. And I think, AI is going to be one of those. Anything this decision support system is going to be with a data lake of some type, and anything that is a decision is going to be a decision tree, and in code, that's going to be AI. That's pretty normal. And there's so many tools out there now. I was going to say, even in ours, a year ago, we were zero AI being developed. Basically, every developer we have is using AI, and about 25 to 30% of the code generated is with AI. And anything we see now that is decision support based or a decision tree, we're looking at an opportunity to bring in AI into that. And it's not, people use AI as, that's the answer to everything. It's not, it's a tool to enable things that modernize and automate the platforms that people are using. It's just make their job easier. I mean, like I try to keep things simple, is make people's jobs easier and more effective and allow them to serve a greater population, because there's less money. We need to make sure that we have the tools enabled where there's less steps, like in session management. When I look at that, that was the first thing that really came out in the EHR space. But there's a lot we can do in the human capital as well, like applicant tracking and tying that to funding sources. There's no doubt about that. That has to happen. And the utilization of people, and those that bring those out will be the leaders in this industry. And that's the ones that people need to be using. session management, note taking. I mean, when using ambient technology, it's like 75% savings in time. Why wouldn't? And that's the number one thing they're doing. They're providing a, clinical diagnosis and therapy. And doing that, if you can save, time and people taking notes and the other 30 minutes to an hour, then the back half, and also doing compliance, why wouldn't you want to do that? That's the reason for the season, I believe.
Mm-hmm. Those are all, like I said, the key tech ingredients, AI or not. I just keep telling people, I don't, it doesn't matter so much what the tech is, but it needs to do the job.
Yeah, I agree. Yeah, and I think it's just starting. We have got to revolutionize all of healthcare is headed down that path, and I think the whole U.S. is headed down that path. And you can, I actually saw the article you put, was it Illinois, that said basically you have to do basically you had to test to let somebody do a clinical diagnosis with a tool.
Yep.
But for those that have been in healthcare most of their adult life, which would probably be me, you do attestation for everything, including your PHI. So the day is coming. It's a matter of when and how. And certainly it's right to regulate that. And you need to give somebody permission to do that. And the models will get better. But over time, attestation is pretty normal. And there'll be a hurdle to overcome. But over time, people won't have a choice because the financials will force them to look at alternatives. That's why telemedicine is popular now. I think home healthcare will take off because of that as well. As like any method that we can to drive down the population that is sick or needs help is going to be adopted over time.
Well, some big challenges ahead for our behavioral health providers.
What advice would you give to us? Like, you get to work with a bunch of, and I call it suppliers, but for us, we're mission driven too, and we're providers in my mind. What would you tell a provider like us?
Well, I keep thinking you and I have shared perspective that way. We share customers.
Yeah.
My biggest single concern is the financial sustainability of the provider organizations that we work with.
Yeah.
That it really is whether you're doing a big consult or a small one, whether you're consulting about a piece of their operation or something as broad as strategy. I mean, I think what we have to be focused on is how do we equip these executive teams with the tools and best practice knowledge they need to succeed and to kind of navigate some of the bumps in the road.
Yeah, couldn't agree anymore. And I wouldn't even add another thing to that. I would say, for us, the better we are, the more consultative we'll be too. And I think all of us forget that. Like, it's not just giving somebody a tool. That's what you do as well. We're both in the same business from that perspective, is teach people.
Yes.
Hand them a fishing pole and then show them the water. It's how do you fish? How do you make sure that you can eat? What do you do with it when you catch it? Really poor analogy, but from a Southern boy, that's a pretty common analogy. So what I heard was data, change is coming, understand where your spend is, understand how to adjust to it, be bold enough to seek out alternatives, and then use scenario-based planning, or preferred, possible, and like.
Yeah.
I love that. Make sure you understand your service lines and when they're consolidated and they're being cut, and be bold enough and understand how to make those changes quickly. What other things would you leave us with, Monica, as we get to the end of the podcast?
Well, I think we've talked a lot about the longer term, but if we're looking from now till the end of the year, I think there are a few strategic issues that I think most provider organization executive teams should tend to. I mean, at its very basic, it's this whole issue of the organizations that survive turbulence the best really focus on financial strength. So manage your portfolio, manage your margins, manage your collections, reduce your debt. I mean, all those things are just the bedrock of being able to cope with the unexpected. I do think we're going to see, and I don't know what this looks like yet, state and local governments, as they do their budgeting process, probably react to some of the cutbacks writ large at the federal level. So be prepared for some, losses in kind of state and local funding contracts. And then just a plug for preparing for the long term. is, I do think that the increase in spend, the pressure from the changes in the bill are going to change the competitive parameters for health plans, and that health plans are going to be looking for more innovative solutions. But now is the time. Our rule of thumb is it's 18 months from first outreach to first dollar when it comes to doing something new with health plans. So if that's in your strategic, in your strategic vision, you should start now. So those are my 3 pieces of, what do you do in the next 3 to 4 months? Those would be high on my list.
One other thing, I think as we look at the landscape coming, you're actually going to have an official report coming out. So if you want more details than just a podcast.
Yep. Yeah, we are doing a kind of series of reports, one of them on CCBHC funding in every state and kind of the different models so people are prepared for any federal changes. We're doing a report on state and local government funding and what proportion of the behavioral health system actually is underwritten by state and local government. We're doing a new report on kind of health plan coverage in each of the markets. So those will be coming up this fall.
Awesome. Thank you for doing that and sharing that. It's always a pleasure and an honor. Thank you very much, Monica, and thank you very much, our followers. Please pass the word along. We'd love you to join us in a journey, and feel free to reach out to us as well. Our website is working, and also feel free to reach out to me.
Great. Thank you, Bob.
Thank you, Monica. See you in See you in a month. Bye.
Thanks so much for tuning in to this episode of the CloudCare Podcast. We hope you found value in this episode. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. That helps others find the show, and we greatly appreciate it. For more information on Continuum Cloud, the only platform built for behavioral health, feel free to visit our website, continuumcloud.com. Once again, thanks for listening, and we hope you'll join us soon in the next episode of the CloudCare Podcast.